Early on in the pandemic, things like masks and hand sanitizer, or even soap, was hard to come by for inmates in our state prisons. But when it came time for prisoners to get vaccinated, Mississippi officials took a much different approach. That may have prevented a mass tragedy, but things did not start out well. COVID-19 specialist Amanda Decker reports.
It's been a devastating year inside Mississippi's prisons. Even if it's hard to believe, it could have been worse. In fact, it could actually be worse right now had Mississippi waited to get inmates vaccinated. The first COVID-19 related death inside a state prison happened on April 13th, 2020. Just 1 month later, the CDC issued social distancing guidelines, which led many states to start reducing crowd size inside the prison facilities. Now, in Mississippi, that didn't happen. In July 2020, with COVID cases rising in state prisons, Governor Reeves vetoed a bill that would have created a parole board that could have started approving some prisoners to be released to ease overcrowding. The bill laid out certain requirements that would be considered for early release, and it would have only applied to nonviolent criminals, specifically those who were about to finish their sentence. Instead, DOC officials focused on vaccination efforts, and in March, Mississippi became one of the first states in the country to start vaccinating its inmates. In many places, inmate cases far outnumber the community infection rate. Nationwide, 2 in every 100 people are believed to have been infected with COVID-19. But among prisoners, it's believed that 34 in every 100 have been infected. But in Mississippi, it's actually the opposite. Although testing remains low inside these facilities statewide, data show that more people in the community across Mississippi have been infected with COVID-19 compared to the rate of prisoners. Now, the decision to vaccinate prisoners early may have saved lives, but had something been done even sooner, other tragedies may have been avoided. I'm COVID-19 specialist Amanda Decker reporting.